I am Lynn Goldman. I am the Vice Chair of the Roundtable on Environmental Health Sciences, Research, and Medicine, and it's my pleasure to welcome you here to today's workshop, and especially our esteemed speakers. This meeting is being recorded and webcast, which means for those in the audience, when there is time for question and comments, to not only use the mics, but also to please identify yourselves. We will also take questions and comments from the virtual audience as time permits. Since its first meeting in 1998, the Roundtable on Environmental Health Sciences, Research, and Medicine has addressed current and emerging issues in environmental health through discussions related to the state of the science, research gaps, and policy implications. The Roundtable has held workshops on issues of domestic and international importance, such as climate change, sustainable drinking water, ecosystem services, health impact assessment of shale gas extraction, the science of obesogens, sustainable development, and data for environmental health decision-making. Today's workshop is being held jointly with the National Academies Roundtable on Population Health Improvement. I'm now going to tell you about the workshop objectives. In the context of the considerations of health equity, economic viability, social acceptability, and political and regional issues, the workshop participants will first receive an overview of the health implications of climate change. Second, explore mitigation, prevention, and adaptation, resilience building strategies deployed by different sectors at various levels, that is to say, local, state, and national, and in various regions of this country. And third, to discuss aspects of collaboration on climate and health issues among community-based organizations, healthcare systems, business, public health, and other governmental agencies, along with lessons learned. In short, this is a workshop that's aimed at sharing and in the spirit of learning about best practices across the country. If you are tweeting, please use the hashtags hashtag PopHealthRT and hashtag EnviroHealthRT as noted at the bottom of the agenda, and if desired, the hashtag ClimateChangeShiftsHealth. If you have any logistics questions as the day unfolds, please talk to our staff at the registration table and around the room. Actually, staff around the room, if you are in here, identify yourselves. Thanks so much to all of you, especially for making this day possible for us. Note that the meeting materials may include slide sets given to staff in advance. Other materials will be posted to the meeting page after the workshop. As we begin the day, I would like to thank members of the Planning Committee for the workshop: Sarili Patel, John Boldu, Linda Rudolph, Henry Anderson, Kathy Gerwig, and Paul Biedritsky. Bio sketches for all the presenters and moderators, including Planning Committee members, are provided in the meeting materials. Without further ado, I turn things over to George Isham.
Thank you, Lynn. It's a particular pleasure to be here with all of you today for this important discussion, as well as those of you on the web. I am George Isham. I'm the co-chair of the Roundtable on Population Health Improvement. Since February of 2013, the Roundtable has been providing a trusted venue for leaders from the public and private sectors to meet and discuss the leverage points and opportunities arising from changes in the social and political environment. And we certainly have got a lot of those going on today. For achieving, and those changes that we're particularly exploring at the Roundtable are for achieving better population health. That is our focus, and those are the conversations that we have had. Our vision is that of a strong, healthful, and productive society which cultivates health, human capital, and equal opportunity. The vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-based policies and dependable resources to achieve it. One of our major activities, the Roundtable holds workshops for members, stakeholders, and the public to discuss the issues of importance to improving the nation's health. We are pleased, very pleased, to join with our sister activity in terms of today's workshop, and really appreciate, Lynn, the partnership that this effort today represents. At the end of today, my fellow co-chair, Dr. Sandy Magnan, will be up here, and we'll invite members of both roundtables to make brief reflections on the day. It's been our custom to make sure that we not only hear what the speakers have to say, not only engage in the conversations that they prompt through their carefully prepared remarks, but also take the very explicit opportunity to reflect on the day's conversation to make a good and robust workshop discussion, not only for the people here in person, people on the web, but in the proceedings of the workshop that are ultimately produced. This meeting today reflects our engagement in one of those major sectors that our Roundtable has felt has a significant impact in health, and that's those factors in the environment. So it's a particular pleasure for us to engage in the intellectual curiosity to discover those factors that may impact health through discussion, through the discussion that we'll have today, and hopefully that'll lay the foundation for thoughtful approaches that it may prompt in many of those watching and those who will read our proceedings in terms of thinking about interventions or policies or other activities that will ultimately improve health through addressing factors that may be surfaced with respect to the interaction of the environment and human health. Lynn and I have the distinct pleasure of having Georges Benjamin here with us today, and so our remarks are appropriately brief. Georges is going to offer some comments to us on the topic of today's workshop. He's Executive Director of the American Public Health Association, and the APHA has declared 2017 the year of climate change and health. So it's particularly appropriate that we have Georges come forward and offer us some introductory comments. Georges, welcome.
Well, good morning, everyone. I've entitled my comments this morning, "The Fierce Urgency of Now." And, I was sitting here in Washington, D.C., and I just remind folks that about 2 weeks ago, we were walking around without our coats, some of us in shorts. And tomorrow we're expecting a very large snowstorm. No one's going to tell you that for sure that's related to climate change. But I think as we think about this, the fact that we're having such huge shifts in climate, such big changes in the environment, which are lots of records being broken, makes a big difference. And I think as we think about why we're here today, we ought to just kind of think about some of those things in the background. And I often get asked, why should the health sector be engaged? And I've often said that I think that climate change is the most pressing public health problem that we have. And the reason I believe that is because from a global perspective, it's huge. It affects every facet of our lives. I also, as a public health person, think that this is an enormous opportunity for us to take a public health approach. In particular, it's one of the best examples of a health and all science approach in terms of doing health and all policies to try to solve a problem. And if you think about the fact that you get people across multiple sectors working together in a variety of ways, from literally how we eat, how we grow our food, how we build our environment, how we live our daily lives, what we burn for fuel. There is enormous opportunities for us to work collaboratively across sectors, taking the politics out of this, simply to make sure that our planet and those of us who are on this planet actually survive is an excellent opportunity. Now, APHA has actually been in this place for a long time. We've been involved in thinking about the impact of climate and health since the early 1900s. And several years ago, our executive board, I think wisely decided that the central challenge of the day was how to figure out how to make the U.S. the healthiest nation. And with that in line, certainly dealing with climate change is certainly in line with that point. I also think this is an opportunity. Certainly we know that climate change is here and impacting our health today. Now I know that there are important policymakers that do not support climate change. Some don't even believe that it's real, and some do not believe that humans are impacting our climate. Therefore, I think because of that, particularly because of the level of these policymakers, it's an essential issue that we need to take on now. I also think it's an excellent opportunity for us to set the table from a health perspective. There's this enormous void that the health community gets to fill that I think is important for us to do. And I also think that if we act now, we can keep this issue in the forefront of the minds of the policymakers, the public, and the people that write the checks. Let me give us 4 suggested health goals, recognizing this is a workshop and that you don't really come to consensus on anything, so these are suggestions. But I think it's an opportunity for us to shift the narrative around climate change, to speak to people's values regarding their health and their loved ones, remind you that health is very, very personal to everyone. People love polar bears, but they love their health and their family's health more. I think it's important for us to serve as a science and policy resource. I mean, the health community can serve as that resource to inform sound public policy and hopefully decision-making to try to evaluate the health impacts, and particularly around health equity as part of what we're trying to do. The idea that we can influence and advance climate policies that we believe will have the greatest impact based on science, grounded in environmental justice and health equity, is an important outcome. And by galvanizing action to advance climate-healthy practices, including behavior change, that can make the greatest impact on public health, and again, health equity. You know, I try to build health equity through most of these concepts. By the way, I obviously stole these concepts from my own staff, so. Which brings us to the year of climate change and health. Well, we really have 2 goals. One is to, of course, raise awareness and to mobilize leaders. At the end of the day, those are the 2 central tasks that we hope to do. And we're really doing that in many ways by proactively planning events, but also adopting events such as this because they align very much with our year of climate change and health. We've adopted this concept with partners, that these are the months that we want to kind of focus on, and the way we're doing that is getting critical partners to pick a month, sometimes one partner, sometimes several partners, but again, to focus on what they're doing. Again, the idea is to try to raise this visibility throughout the whole year, to try to build momentum, with the capstone event, of course, being the APHA annual meeting in November. But these ideas are a way of trying to talk about very, very important subjects in climate change through the lens of health, the impact on health, each and every month of the year. You notice it also goes beyond our annual meeting because APHA is in this issue around climate change and in many ways planetary health for the long haul. I also want to just publicly thank Vice President Gore, because I talked about our idea of both proactively planning events and adopting events. So some of you may know we just recently had a event down in Atlanta that Vice President Gore and some of our partners came together to try to build on a deferred meeting that the CDC was not able to hold. It's called the Climate and Health Meeting. We had 5 primary co-hosts, including Vice President Gore and his Climate Reality Project, the Harvard Global Health Institute, University of Washington Global Health Institute, and the University of Washington Center for Health and Global Environment. And of course, some of you may know that these are really powerhouse institutions in terms of the climate change project that we're doing in this country. Thoughtfully funded by the Turner Foundation, and I also want to give a shout out to President Carter, who allowed us to use the Carter Center. And he actually came to the meeting to greet the recipients at this meeting we had. We had about 340 local participants and thousands who reviewed it remotely. It was webcast, and during the middle of the day, I kind of reached over to President Gore and showed him that we were twinning number 4 on Twitter, but my staff corrected me later on the day and told us that we had ultimately twinned it to number 2, which is always kind of exciting because we are in a Twitter environment these days. But nonetheless, I think that this tells us that there's a lot of people that are interested in this. We had over 50 partners who joined up and signed up for this project. So it was an important meeting to get things started. And we, in effect, kicked off our year of climate change and health. And then finally, in November, the APHA annual meeting, which will be held in Atlanta from November 4th through 8th, I think is an important opportunity for us to capstone what's going on here. And in closing, I just take you to a quote from Martin Luther King where he said, "We are now faced with the fact that tomorrow is today. We are confronted with the fierce urgency of now. In this unfolding conundrum of life and history, there is such a thing as being too late. Being too late. We must move past indecision to action." And I think that's what we mean when we're talking about doing this for climate change as a way to save our planet and a way to save ourselves. Thank you very much, and really look forward to your workshop.
Georges, we have a couple of minutes. I don't know, I mean, it's not part of the plan, but would you be okay with taking a couple of questions, if there are any in the audience?
Are there any questions out there?
I'd start off the questions. I see you in your 4 points talked about the shifting the narrative to addressing the values that people have for health. I wonder if you might expand upon that just a bit.
Sure. So, you know, the challenge is that people always think that the trade-off has to be what they're going to lose from climate change adoption, from getting off of fossil fuels, from trying to move the needle. And I think the point is that we ought to be talking more about what we gain, particularly from a population perspective. The fact that by acting now, we can do things that make the environment cleaner and build jobs, ultimately at a reduced cost to society. And if one is thinking from a population-based perspective, there's no question that this is going to happen, that it's going to improve our overall well-being. But even if you're not into population health, even if you're into individual health care, as many of you know, I'm a former emergency physician, but just the impact of having less people walking in with asthma attacks, less people walking in with heart attacks, less seniors being impacted by heat-related injury, to the extent that we start building differently so that we're not continuing to have communities that are flooded, that we're not so much worried about vector-borne diseases that we know are going to happen because stuff happens. But if you think about in the last few years, we've had, frankly, a public health emergency almost every year for the last 5 years. And those are just the infectious disease emergencies. And while people are focused that those issues may be only in one part of the country, we know that the environment is changing and the receptivity of those environments for those vector-borne diseases is growing. But we can stop that. We can change that. It may take years, but we can change it.
Terrific. Are there other questions?
Yes, come up to the mic if you could, actually.
There's a microphone on either side.
In the aisle. I'm actually quite loud. Can you hear me? Yes, but the people on the internet may not be able to hear you, which is why we're requesting you use the microphone.
everyday sort of, like I said, I was loud, health impacts or things that we're sort of dealing with in the immediate right now versus trying to get us to take proactive or think proactively and make decisions around something that's anticipated in the future and maybe some of the connections that you're making when you talk to decision makers.
Well, I think that putting my hat on as an old ER doc, reminding folks that we do have to take care of the emergency that we have in front of us. So tomorrow we're going to have a big snowstorm, certainly on the East Coast. And that means we've got to have the system in place to respond to that snowstorm. That means, from my perspective, you need to have a well-structured, well-funded public health system and emergency response system to deal with all those kinds of things, including not just simple things like snow removal, but recognizing that you're going to have to deal with seniors who are going to lose heating, the reporting systems to know who's going to be at risk for that severe weather when it hits. So that's both a response capacity, but having that capacity is good for mitigation. That's important now because, frankly, the core governmental public health system has been devastated over the last several years for a variety of factors. And so talking to people about the importance of doing that is something we need to do. We know that this coming spring, we may very well have the return of Zika, at least in the South, and it may come a little further north than people think. And that means that now's the time when we're doing budgets to begin building mosquito control programs. We let our mosquito control programs in the country languish. We're telling them, don't gut EPA regulations. And there's an effort now, you may know, to gut those regulations. And we're telling them that that's the wrong approach. Because if you gut those regulations, you'll be going back to a time when people will be at extraordinary risk because of, in fact, bad air and water that isn't safe to drink. So we are trying to make the case for the reasons we have. The reasons these regulations are in place is because we had a problem that we needed to fix. And we're trying to make that argument. And we're trying to get the average American to understand that so that they can then go and bang on the door of the resource allocators and say, please don't change that because we think we need to have these systems, these programs, these regulations in place. I also point out that anyone who thinks that this is pretty harsh, but if you're dead, you really can't have a job. If you're sick, you really can't have a job. So that we need to make sure that this job argument is not one that should hold, particularly since we know that green jobs are growing like a weed, as they say.
Thanks a lot, Georges. Thank you very, very much.